series مالتنا. ردت أوضح points about the welcome classification of malnutrition. We did mention that according to the grade of weight loss, we will classify the type of malnutrition. So we meant by 60 to 80% of the 50th percentile is what you are going to see just now. Growth chart هسه شايفيها شباب؟
نعم دكتور.
فهذا اللور كيرفز اللي هي المتعلقة بالويت سنتايلز، وهذا هو اللي قصدنا به ال 50th centile. فإذا البودي weight of the child is within 60 to 80% of the 50th centile هو هذا الكيرف اللي مقصود به. فمثلا البيبي اللي هو الايج مالته خلينا نقول 10 months، هذا الايج مالته هنا، والويت فرضا مالته كان 6 كيلوغرامز، فخلينا نقول 7 كيلوغرامز. فاني ابو ال 10 month ال 50th centile مالته هنا واقف اللي هو راح يكون تقريبا 9.8 كيلوغرامز. شايفين؟ فالسبعة ايش قد تسوي من ال 9.8؟ عملية حسابية أطلع النسبة المئوية مالتها. إذا كانت أقل من 60% أو بين ال 60 to 80%. واضح؟ فهذا الايج هنا اختارينا الايج مال البيشنت مالتنا، ورحنا على الكيرف مال ال 50th centile أشوف الايج مالته إيش قد المفروض ال 50th centile of his weight، وأشوف هو الأكتوال weight مالته إيش قد يسوي من هذا الرقم. يعني أنا راح أستخرج رقم من ال 50th centile من اللاين مال الكيرف of the 50th centile according to the age of my patient. مثلا الايج مالته 3 months، فهذا ال 3 months وين راح يقطع ال 50th centile؟ راح يقطعه بال 6 كيلوغرامز. فهذا هو ال 50th centile of the normal body weight for the baby who is 3 months of age. إذا أنا الأكتوال weight مال البيشنت اللي عندي دا أتعامل وياه هو 5 كيلوغرامز، فأطلع 5 من 6 إيش قد تسوي كنسبة مئوية، حساب مال رياضيات، حساب عرض مثل ما نقول. فإذا كان هذه 5 من 6 هي دا تسوي less than 80% أو less than 60%، راح أروح أشوف إذا أكو associated edema أم لا، وعلى أساس هاي الفايندينج راح أسوي categorization للtype of malnutrition according to the criteria اللي هي اتفقنا عليها سميناها welcome criteria. تمام؟ I hope تمام. لأنه أنا ممكن أسأل يعني إنه أنا طيب patient والage مالته كذا والweight مالته كذا، وممكن يعني أنطي أقول ال 50th centile of this age is so and so، أو أعطيكم growth chart وأقول أنتوا طلعوا ال 50th centile مالته إيش قد وصنفوا لي which type of malnutrition هذا. nutritional problems. I hope إنه السكوت علامة الرضا. إذن everything is settled هسه. Now we are going to discuss the problem of rickets. Slides واضحة يمنا؟
نعم دكتور.
Okay, the rickets is defined as failure of mineralization of growing bones. وهذه حطيتها bold لأنه rickets applies only to growing bones. يعني when the child is out of the period of childhood, is out of the period of growth, such problem will not be named as rickets, it will be named as osteomalacia. So failure of mature bone to mineralize is named as osteomalacia, while when it is in the growing period, we call it rickets. What are the causes of rickets? It's either nutritional deficiency of vitamin D, And in that instance, it will be either inadequate exposure to the UV light, أشعة الشمس, or inadequate intake of the vitamin D or calcium. For three factors may end up in what is called as nutritional rickets. This problem is especially seen in dark-skinned infants or in breastfed infants to mothers with inadequate exposure to sunlight. And this applies especially for multiparous mothers because the mother should receive extra supplement of vitamin D all along the pregnancy period and as long as she breastfeeds. So failure to supplement the mother with the required extra vitamin D will affect her stores of this vitamin, especially in multiparous mothers. So it will end in a much lower vitamin D content of her breast milk. And when the baby is dark-skinned, definitely the melanin will somewhat interfere with the absorption of the ultraviolet light. This is why they are more liable to develop rickets and vitamin D deficiency. So the first type we've mentioned, it was nutritional rickets. There are other types of rickets. There are hereditary forms of rickets, and there is the rickets due to chronic diseases of the liver or the kidneys. Hepatic and renal disease will interfere with the vitamin D metabolism. And there are other causes whom they are concerned with the loss of the vitamin D or failure to absorb the vitamin D, for example, celiac disease and cystic fibrosis, which is a disease of the congenital disease of exocrine glands of the body, which produces viscid secretions of the exocrine glands, leading to early obstruction of their ducts. So one of these ducts is the pancreatic duct, so there will be deficiency of the pancreatic enzymes inside the bowel lumen, ending in failure to absorb the vitamin D. Celiac disease may end in steatorrhea, that is failure to absorb the fat in the food. And since vitamin D is fat soluble, so the vitamin D present inside the bowel lumen will be dissolved in the unabsorbed fat and it will be lost with the stool. Children maintained on long-term anticonvulsant therapy, anticonvulsant drugs, many of them, they are enzyme inducers. And we mean by that is that they are going to activate the enzymes responsible for the degradation of vitamin D, so enhancing the degradation of vitamin D in such children. This is why usually they need extra supplement more than the normal child. What is the role of vitamin D in our body? It facilitates the intestinal absorption of calcium and phosphorus and from the intestine, and it enhances the reabsorption of phosphorus from the renal tubules.
دكتورة
نعم.
بس إذا تقدرين يعني تعيدين لنا التأثير مال الأنتي كونفولشن على الفيتامين دي.
Anticonvulsant drugs, pharmacologically speaking, they are called enzyme inducers. Many types of them, for example, the phenobarbs, the phenytoin, هذول كلهم enzyme inducers. So they activate the enzymes that are responsible for the breakdown of vitamin D. So using these drugs, it will enhance, it will hasten the breakdown of the vitamin D in our body. So it means we are increasing the losses of vitamin D. This is why usually they require a higher maintenance dose of this vitamin. We mean by maintenance dose, which is the normal daily requirement of any dietary item, whether it is a macro or a micronutrient, لأن أغلبها معرف إيش قد الnormal daily requirement for the human being from such nutrients. But there are some disease conditions that will change this maintenance requirement in the form of an increment or a decrement. إما تزيدها إما تقللها. فالanticonvulsant therapy will increase the requirement from vitamin D. خلونا نشرح هذا السلايد بس. So vitamin D is not always essential. يعني we mean that an external supplement is not always essential because the body can make it if exposed to enough sunlight. It is synthesized from the cholesterol present in the skin. There are certain hormones and vitamins synthesized from the cholesterol in our body. One of them is the vitamin D. So even if we do not take vitamin D from our food, if we have enough exposure to the sunlight, we can get what we need through the skin. This is because the ultraviolet light will act on the cholesterol present in our skin to produce what is called as cholecalciferol or the vitamin D3. This is a route. The other route is from diet, from dietary source, and from which usually we get the ergocalciferol, which is D2. And sometimes also we get the cholecalciferol or the D3. Do not bother a lot about these nomenclatures. دائما عندنا D2, D3. D2 ممكن يجي من الفود. D3 usually from the sunlight effect on the skin. Both of them, they need to be activated by hydroxylation. A first step would be done in the liver. This will produce the 25-hydroxy D3 in the liver. Then it needs to be further activated in the kidney to produce what is called the 1,25-dihydroxy cholecalciferol, which is the active part of the vitamin D. So the active vitamin D, اللي هو, it is called calcitriol. Again, you do not need to memorize this name. Is going to act on our bones to enhance the calcification of the bone, and it's going to affect the intestine to increase the reabsorption of both the calcium and the phosphorus, and it may work on other tissues, including the kidney itself, to enhance the reabsorption of the phosphorus, but not that of the calcium. So these are typical shapes of children affected by rickets. So figure A is a comparison between a normal child and another with rickets. Both of them, they are of the same age. So the ricketic one, this one on the right side of the picture, why is that? Because there are features of hypotonia. You can see how he is flexing his legs extensively in contrast to the other normal child sitting beside him. بسبب الهايبوتونيا هو دا يبرم رجليها البرمة القوية. This is the one with the rickets. The picture on the right side of the slide, the figure B, the normal one is that child who is standing straight, and the ricketic child is the one with the bow legs, اللي هي high typical picture of advanced untreated rickets. This picture is from the history, because in the previous days when there was no pharmaceutical preparations of vitamin D, people in Europe, they used to treat children suffering from rickets by exposing them to ultraviolet light, synthetic ultraviolet light, because there is no much sun in Europe. So how does it manifest? Usually at the end of the first year onto the second year of life, هذه the most frequent period when they start presentation. But breastfed babies to mothers with osteomalacia may develop features within 2 months of birth, 2 months of life. If the mother is deficient and she herself is suffering from osteomalacia, she is severely depleted from vitamin D, مثل ما وصفنا, due to multiparity and lack of supplements of the vitamin during the period of pregnancy and lactation. So her milk would be severely depleted, and again even her fetus in utero احنا قلنا most of the nutrients are stored in the fetus during the later weeks of the last trimester. So when she is severely deficient, معناتها nothing will be added to the stores of the fetus in utero from vitamin D. And this is why such babies, to such mothers, they may show features of rickets even from the age of 2 months of life onward. What are the clinical manifestation? One of them is what's called craniotabes. Craniotabes, we mean by it a softened skull bones, especially the occipital bones, so that when we press in the area behind the ear, it gives the feeling of a ping pong ball. يعني تفعص جوا الأصبع كأنما طوبة البينج بونج، لابد كلكم شايفيها، تفعص وترجع. This is one of the earliest manifestations of vitamin D deficiency and rickets, and usually it is seen early in life until the end of 1 year of life, because at the end of the first year of life, the occipital bones are going to thicken spontaneously, even if the child is still suffering from rickets. So this feature will disappear after the age of 1 year. The other clinical manifestation is a palpable enlargement of costochondral junctions, what we call the ricketic rosary. Again, these may show in the first year of life onward, all along childhood. ممكن نشوف هاي الفيتشر اللي هي palpable enlargement أو flaring of the ribs at the site where they join to the cartilaginous part of the rib. Soon, inshallah, you will see a picture explaining this finding. Another feature is thickening of the wrists and ankles. Again, it may appear early and it will extend and stay all along childhood if the child is not treated from his ricketic state. The anterior fontanelle in such children is usually larger than normal, and it may suffer from delayed closure. For example, the anterior fontanelle, as you know, it may normally close between 9 to 18 months of age. The closure may be delayed beyond this period. There will be delayed eruption of teeth. The head may be looking as a box-like due to the frontal bossing of the forehead. The child may develop what is called the pigeon chest, and we mean by it is the anterior displacement of the sternum, especially if he is suffering from recurrent chest problems. What's called the Harrison sulcus, which implies for the line of attachment of the diaphragm to the softened ribs. So especially it is seen in children again suffering from chronic respiratory problems. In addition to rickets, there will be this Harrison sulcus. When the child starts bearing weight on his legs, there may be bending of the softened shafts of the long bones, leading to bow leg or sometimes knock-knee. فإذا when the infant is still in his mother's lap, he's still not standing, not walking, and not bearing weight on his legs, you do not look for this feature. بمعنى هذه من الفيتشرز اللي تظهر later in life, while craniotabes usually it appears early and it disappears early. So bow legs or knock-knee are features of rickets, deformity of the spine in the shape of kyphosis, scoliosis, or even kyphoscoliosis, pelvic deformity leading to birth problems in the future motherhood, and finally reduced stature, بمعنى short stature. This is because of the deformity of the legs. Sometimes infant may present as neonatal tetany, that is hypocalcemic tetany during the neonatal period, يعني first 4 weeks of life. هذول اللي whom we described that their mothers may be suffering from osteomalacia and they may show early in the shape of neonatal tetany. Children with rickets, usually they are liable to suffer from repeated respiratory infections because in addition to all what have been described, usually they suffer from hypotonia, and this hypotonia of the intercostal muscles may enhance the acquisition of recurrent lower respiratory tract infections. This also simplifies what are the features of rickets. There may be a large head, اللي قلنا box-like head, protrusion of the forehead, there may be a curved humerus, there may be a pigeon chest اللي هي anterior displacement of the sternum ده تشوفوه زيدنا anteroposterior diameter of the chest. There may be flaring of the wrists يعني تكون wider wrist joints. There may be protrusion of the abdomen. This is usually due to the laxity of the abdominal muscles. There may be a curvature of the femur and tibia fibula. So both these conditions are characteristic of rickets. Some may develop genovarum and some may develop knock-knee or genovalgum. This is what we mean by flaring or widening of the wrists. Simply, it is due to flaring at the end of the metaphysis of the long bones. الميتaphysis of the long bones يكون rarefied, hypocalcemic, and usually it flares near its ends, يعني تفرش قرب الأطراف مع نهاية long bones. This is what we mean by frontal bossing, or a box-like head in a child suffering from rickets. This is what we meant by the ricketic rosary, اللي قلنا flaring of the ends of the long bones at the area of the costochondral junction, يعني في منطقة اتصال البوني rib with the cartilaginous rib. Flaring فرشة the end of the rib, فرش صار wide. This is why usually it is seen and sometimes it is palpable also as nodules that تشوفوها obliquely beside the sternum, مو الsternal junction, هذه costochondral junction. فده تشوفها أحيانا visible and palpable even. So it's a knobby deformity. It is called the rachitic rosary. The weakened ribs also may be pulled by muscles to produce flaring of the diaphragm, which is called the Harrison sulcus, and some children may develop the pigeon chest deformity. هذه اللي هي pigeon chest deformity وده تشوفوها بالإكس-راي هنا. It is anterior displacement of the sternum. ده ينطينا shape of barrel-shaped chest or increased anteroposterior diameter of the chest. Usually such children are also suffering from chronic chest problems, for example, asthma, in addition to rickets and soft bones, so they are liable to develop this deformity. This is the funnel chest or pectus excavatum. It's not related to rickets. It is a normal physiological change. So spinal deformities, as we mentioned, in the shape of scoliosis or kyphoscoliosis. This is what we mean by kyphoscoliosis. همينا side-to-side curvature and anteroposterior bending of the spine. So, how do we diagnose rickets? In addition to the clinical findings, there are radiological and laboratory findings that may help to identify what is called nutritional rickets. So what happens in nutritional rickets, usually there will be reduction in the serum calcium, serum phosphorus, the vitamin D level in the blood. All of them, they are lowered. There is an increment, زيادة, with the parathyroid hormone, the alkaline phosphatase, and the urinary phosphorus level. So usually the diagnosis, practically speaking, is done at our labs by looking at the serum calcium and serum phosphorus level in addition to the alkaline phosphatase in the blood, because their measurement is available daily and it is cheap, not costly. Order for a vitamin D level. هنا الفيتامين دي level هذا اللي هو ال 25 hydroxy اللي نسوي بس أول step من الهيدروكسيليشن, or you can measure the dihydroxylated active form of the vitamin D. Anyhow, serum calcium and phosphorus, both of them will be lowered in addition to a rise in the alkaline phosphatase. It signifies the presence of vitamin D deficiency and nutritional rickets. So what happens actually with the beginning of the process of rickets, there will be initially a normal calcium level and normal phosphorus level, but a rise in alkaline phosphatase. With the progression of the deficiency, the serum phosphorus would decline and the alkaline phosphatase remains high, and the last will be reduction in serum calcium in addition to the phosphorus and a high level of alkaline phosphatase. So looking at this triad is necessary to identify nutritional rickets and differentiate it from the other types of rickets that we have mentioned previously. We have mentioned congenital types of rickets, and we have mentioned rickets state secondary to chronic diseases of the liver or the kidney. What is the classical radiological finding? Typically, we order an X-ray of the wrist joint of the hand, and usually all what we do unilateral, for example, the left hand, to reduce the exposure of radiation to the child. What will be seen, expected to be seen on X-ray, is widening of the distal epiphysis, fraying and widening of the metaphysis, and angular deformity of the arm and leg bones. This is sometimes seen. So this is what we mean by fraying and cupping. فهذا الtypical view اللي احنا نطلبه هي wrist X-ray of a single hand of the child, expecting to look at the ends of the long bones. So there will be widening of the diaphysis and the metaphysis with fraying. fraying يعني هذا اللي دا تشوفوه، يعني ال end of the metaphysis is not a pencil line drawn، مو مثل خط القلم. المفروض ال end of the bone كأنما مخطوطة بقلم، تكون straight، بينما هنا it is frayed يعني مشرشرة، دا تشوفوها كأنما بها شراشيب، soft مثل ما نقول بالعربي تايخة. And there will be cupping، دا تشوفوه شلون مقعر ال end of the hand. After treatment دا تشوفون رجعت back to normal، هسه كأنما it is a pencil line ال end of the bones، وراحت ال concavity، ماكو cupping، and there is a clearly delineated well calcified end of the bone. So lab findings, we have discussed them already. There is another point to be mentioned. You should be aware of the normal values of the serum calcium in the blood and the serum phosphorus. The serum calcium is something around 9 to 10 milligram per deciliter, and the serum phosphorus is something between 4 to 6 milligram per deciliter. So the product of multiplication of both items، احنا لأنه قلنا همنا النورمال فيجر هو بي رينج، فمو دائما ينطيني good impression is it normal or not. وقلنا initially ممكن ينزل بس الفوسفورس ويبقى الكالسيوم نورمال. It takes time، يلا اثنيناتهم تنزل. فلهذا يعتمد حاصل الضرب مال التو metals هذولا، which should be in the range between 40 to 70. فإذا multiplication value of calcium and phosphorus in milligrams in the blood is less than 40, usually it denotes the presence of vitamin D deficiency. The alkaline phosphatase is always elevated from the start. So how is it treated? Nutritional rickets is treated with high doses of vitamin D in the shape of 500 to 1,500 international units per day orally. Usually it is given for 4 to 6 weeks. And thereafter, the child should return back to the normal daily requirement. اللي هي it helps to prevent the recurrence back of the ricket state. So how do we prevent the recurrence, or initially any newborn, any young baby, how do you prevent him from developing vitamin D deficiency and rickets? Is by good exposure to UV light, which means that the child would need at least 10 to 15 minutes exposure to the UV light daily. But this procedure is sometimes hazardous, and it is not allowed for infants less than 6 months of life because the sunlight may be harmful to their skin. So the other preventive way is to provide their normal daily requirements, especially if they are breastfed babies, because as you remember, we've said even in the good states, the breast milk is not a good source for vitamin D. What it contains from this vitamin is low. It does not satisfy the need of the infant. So normally, the normal newborn baby who's maintained on breast milk should be started on oral administration of vitamin D within the first 2 months of life. يعني خلال الشهرين الأولى من الحياة يبدي على daily intake orally of 400 international units of vitamin D. There are some babies whom they are more liable for this deficiency of this vitamin. For example, premature babies or breastfed infants whose mothers are not exposed to adequate sunlight and whom they are multiparous and not supplemented. So such babies are highly liable to receive the normal maintenance to prevent them from developing the complications of rickets. Vitamin D definitely should be administered to any pregnant and lactating mother. Pregnant mothers starting from the 2nd trimester of pregnancy on to delivery and lactation, all along lactation, they should be supplemented with vitamin D. هذه السلايدز شفتوا مثيلاتها. هنا اكو cupping and fraying. ده تشوفون ends of the bones حتى ما مبينه. shaft of the long bone is actually rarefied and the ends are frayed and cupped مقعرة. While after treatment, this is the end of the bone. It is a pencil line-like end of the long bones. This is what we mean by a widened wrist due to flaring of the ends of the long bones. So this is all what we have for this day. Anyone have any question?
دكتورة بس شنو السبب مال كوستو كروندال جاكشن هاي يصير بيها مال ركتك روزري؟ يعني ايش يصير؟
هي
نتيجة
كل اللونج بونز الشافت راح يكون rarefied, not well calcified, and it flares near the end. يعني يفرش near يعني تخيليها مثل كعك وانت تخمسيه بالحليب او بالشاي. المنطقة اللي راح تكون رخوة تلقائيا راح تفرش. فهي هاي الفكرة. كل اللونج بونز الشافت soft and poorly calcified, and near the end it will flare, it will splay, راح تمتد وتفرش بالعرض. فكل الجنكشنز كل الجوينتس it may develop this flaring, this widening. واضح؟
اي واضح دكتورة. اشتي